Hi, welcome to Healing Tunes. Today we are discussing about trigger points. What is trigger point? A trigger point is a hyper irritable spot, a palpable nodule in the taut bands of skeletal muscles fascia. Direct compression or muscle contraction can elicit jump sign, local tenderness, local twitch response, and referred pain, which usually responds with a pain pattern distant from the spot. What is jump sign? Jump sign is a characteristic behavioral response to pressure on a trigger point. Individuals are frequently startled by the intense pain. Local twitch response as a transient visible or palpable contraction of the muscle and skin as the tense muscle fiber contract when pressure is applied. In trigger points, referred pain. Referred pain, also called reflective pain, is a pain perceived at a location other than the site of the painful stimulus. Pain is reproducible and does not follow dermatomes, myotomes, or nerve roots. There is no specific joint swelling or neurologic deficit. Next, we are discussing causes. Main causes is the aging. Then next is injury sustained by a fall, by stress or birth trauma. Third is a lack of exercise, commonly in sedentary persons between 20, 25 to 55 years. Mostly 45 percentage are men. Then next is bad posture. Upper and lower crossed pattern, sway back posture, telephone posture, cross-legged sitting, etc. Fifth one is muscle overuse and respective microtrauma, weightlifting. Sixth one is chronic stress conditions, anxiety, depression, psychological stress, etc. Next is vitamin deficiencies, vitamin C, D, B, folic acid, iron, etc. Then sleep disturbance. Last one is joint problems and hypermobility. Trigger points classified. First one is primary or central trigger points are those that cause severe pain locally at the pressure with irradiation according to referred pain map. Usually are based around the center of muscle belly. Next is the secondary or satellite trigger points arise in response to existing central trigger points in surrounding muscles. They usually spontaneously withdraw when the central trigger point is healed. Can be present in the form of cluster. Then active trigger points is any point that causes tenderness and referred pain pattern on palpation. Almost always central trigger points are active and some satellite trigger points are also active. Inactive trigger points can eventually become active if there is a provocative factor. Then inactive or latent trigger points can develop anywhere and under fingertips feel like jumps but are not painful. Can increase a stiffness of the muscles. Diffuse trigger points are commonly happen in case of severe postural deformity where initially primary trigger points are multiple. So secondary multiple trigger points are only a response of a mechanism. Ligamentous trigger points. Even ligamentous can develop trigger points. Presence of trigger points in the anterior longitudinal ligament of the spine can result in the neck's instability. Some knee pain syndromes are successfully healed when treated ligamentous patella and fibular collateral ligament. Next, we are discussing differential diagnosis. Actually, differential diagnosis is the process of differentiating between two or more conditions which share similar signs or symptoms. Then here, fibromyalgia, then musculoskeletal diseases like occupational myalgias, post-traumatic hyperstability syndrome, joint dysfunction, tendinitis, and bursitis. Neurological disorders, trigeminal neuralgia, glossopharyngeal neuralgia, uh, s- uh, s- spinopalpatine neuralgia. Systemic diseases, systemic lupus erythematosus, rheumatoid arthritis, gout, psoriatic arthritis, infections, limb disease, hypoglycemia, hypothyroidism. Heterotopic pain of central origin axis 2 type disorders, psychogenic pain, painful behavior. Next, we are looking symptoms and clinical findings. A patient usually asks for help due to a chronic pain state. Example, headaches, aches everywhere, morning stiffness, TMJ syndrome, and tinnitus, etc., which in reality is often physically away from the active trigger point. Muscle weakness or imbalance, altered motor recruitment in either the affected muscle or in a functionally related muscles. Then changes in range of motion. If the pain feeling, range of motion will be reduced. Then painful movement and movement that sometimes can exacerbate symptoms. Tension headaches, migraines, and temporomandibular joint problems as accompanying symptoms. Then finally, postural abnormalities and compensation. Then how will diagnose the trigger point? No laboratory test or imaging techniques has been established for diagnosing trigger points. Firstly, the exact location and right trigger point should be palpated. What we look for are nodules or lumps in the muscles or fascia with sometimes a temperature changes in zone of active trigger points. Okay, next session we will discussing the find out the trigger points. Each muscle, each trigger points is the next class onwards. We will find the trigger points. Please subscribe the channel, like the video, share to your friends and colleagues.